All right, I don't see anybody else hopping on to join us, but I'll keep an eye on the waiting room just in case. But just again, this is just a very casual information session about our equity and access grants. We're going to start by just going over what's on the website, kind of the publicly facing information, and then just open the floor for questions so we can talk about unique situations, opportunities, anything that you have specific questions on. So it's meant to be a back and forth. Please feel free to interrupt me at any point. This is not a formal presentation, but it's meant for us all to be able to talk through this and kind of answer questions as they come up. Admitting one more person very quickly. I'm going to go ahead and share my screen and we'll just run through the website just so that we can see what's there and we'll walk through the program a little bit better. And then we will open it up for questions. Let me see if I can share my screen. Perfect. All right. All right, so getting started on the Equity and Access Grant page. This is a program that we started last year. It was our first year with the Equity and Access program. And it was something that we started because we saw a need in our community to be able to support nonprofits who were doing work in this space. 2020 was a big year. And it was something that we wanted to be able to jump into to really display our commitment. We were doing a lot of work internally. We had a diversity, equity, and inclusion task force. Our board was involved. We were doing this work inside of our own space, and we wanted to make sure that we could help nonprofits do this work inside of your spaces. So that's really where this program stemmed from. Looking down, we were looking for grants in the range of $5,000 to $30,000. The reason for that is that we want, the $5,000 is kind of, you want to hire a consultant to come in and do training for your staff, something like that that's a little bit of a smaller scope of project. And then they can go up to $30,000, primarily because, we are also working inside of a budget for this program. So we're looking for requests that fall inside of that range. So you can fund smaller requests as well as those larger 30,000. So looking at the first box here on the webpage, we have funding priorities for the program. The reason that we put funding priorities on our website are not to exclude projects that don't fall into this. And that's kind of the first line here. They're not exclusionary. The reason that we outline them for you is these are linking to streams of available funding that we have on the back end. So I like to describe my job kind of as a matchmaker. So I'm talking to nonprofits in our community, learning about what projects you have going on, seeing what opportunities you are looking for funding for. And then I'm also looking internally at our funds. So we have about 1,500 different funds that were all set up by different donors, and they all have different purposes and also different kind of amounts tied to those funds. Those purposes can be highly restricted. They can be, for breast cancer research, or they can be very open-ended all the way up to unrestricted funding that we have discretion over. So when we look at funding priorities anywhere on our website, they're designed so that you can see some of our larger funding streams. We want to kind of pull those out so that you're aware of where we have funding. And once again, some of our funding is unrestricted, so we can also meet requests that don't hit these targets. But it gives us a backbone for what we're able to fund, and we're trying to communicate that information to you. So that's really where this idea of funding priorities comes in. So you'll see here, we do have a priority for health and human services projects. That's because a lot of our funding is focused in that health and human services area. And then we're really targeting projects that are working with populations who are facing barriers in our community, with some examples listed here. Also in previous years, we've had a healthcare grant opportunity that was run as a separate cycle in the springtime. This year, the healthcare funding has been tied into the equity and access grant cycle. And that's because in last year's cycle, we saw basically every project that we funded through healthcare was really doing work in that equity space. So because they were doing that work and because we saw that alignment taking place in our community, we moved those funds into this program. So if you've previously applied to the healthcare program, this is kind of your avenue that we'll move forward with this year. And then looking at eligibility, the main eligibility here is that you have a profile in the giving partner that is up to date. If you have any questions about that, get in touch. We can kind of provide you with the step-by-step instructions of things to look for to make sure that your profile is up to date. And then the other thing is that if you've already received an equity and access grant within the last year of up to $30,000, we probably would not re-grant until that grant has been closed and we have seen a report for that grant. And then looking at the application and review process, we'll be running 2 cycles of our Equity and Access Grant this year. So one that's open now, and the applications will close on September 3rd. And then we'll be running another cycle where the application will reopen in December of this year and then close in January. And then we'll take February to kind of score, go through our committee process, and people will know by March of that decision. So when we talk about an application being open, we like to leave our applications open for, 5 or 6 weeks at a time to give you plenty of time to see the application, to get familiar with it, answer the questions. And then you notice there's a window of about a month to 6 weeks built in on the other side. What we do during that time is we go through all of the applicants, everybody who submitted. We do an initial audit of your application. So we make sure that it fits the criteria for the grant program, make sure that you're giving partner profiles up to date. If those things are both, kind of did take place, they're both looking correct, then we send your application to a committee. So we have grant committees for each of our cycles. The grant committees consist of our staff, our board, and then also community experts. So we have a lot of community members on this committee, and that's a really important piece for us because, if we say that we're working in health and human services, targeting some of these populations, we want to make sure that those populations and those sectors are represented on our committee. So we have a lot of community members on this committee. We will send the applications out to the committee. Each committee member then scores them independently. So reads through, scores them based on a common rubric. And then we have a big committee meeting where we all get together. We talk through the applications in order of highest scoring to lowest scoring, and we allocate funding as we go down. So that's kind of how our decisions are made on the back end. We have this committee, the scores are a great guideline for how our committee discussion goes, but that discussion is a really great point too for our committee to be able to ask questions. If they have questions that we need to follow up with you on or with any nonprofits, that's the time that we would do so. So we would reach out sometime in that review window with specific questions from the committee. And then, so that process takes a little while because depending on the number of applications, we want to make sure we're doing a very thorough job of looking through them, making sure the committee has time to look through them, and then making sure we're having a really thorough discussion around them. So that is a general outline of the Equity and Access Program. I know that you've been able to see that yourself online. So this is where I really want to open it up for questions. I'm going to stop sharing. I can always reshare if anybody has questions about something that's on the website. But I really want this to be, casual, ask us your questions, bring up proposals, anything specific that you have for me. I'm happy to help you with that.
This is Anita Rogers from the SOAR Learning Center. Good morning, everyone. One of the populations that in terms of access, and we note that it's not necessarily focused on, but probably needs to be, are kinship caregivers. 25% of our population are grandparents or other relatives taking care of children. Their needs are unique. Now it's in an educational setting, but also if they tend to be older, there's health-related issues that interact with the education. Would that be a viable population in terms of equity and access?
Absolutely. And I think, in the application, and I noticed when we were going through that page, I forgot to mention there's a preview button so you can preview the application too and see what questions we have.
Yeah, I printed it out. Yeah.
Oh, perfect. Yeah. So there's a question where we ask about the demographics that you're serving. And I think that that's a great space to really describe not only who you're serving, but also why, the needs of that population. And especially if it's not a population that we've bulleted out that we're specifically targeting, it's a great place to kind of bring that need to our attention.
And so we could talk about the interaction between the health of the caregiver and the educational needs of the children, and also the trauma that the children experience. That's also a healthcare issue. Okay.
Absolutely. And that's something we're somewhat familiar with. I'm sure you've heard of our 2-gen approach that we apply to a lot of our work that we're funding in the community and that we're working with, the area where we're working with the whole family unit because we know that some of that trauma can be passed down, that there's these kind of intersections within a family. And it's interesting, you mentioned the kind of non-parental caregiver, that's almost a 3-generation approach where we're talking about the grandparent, the parent, and the child.
One more question, where can I get information about your 2-gen report, 2-gen approach?
That is a great question. I believe we have it on our website.
Okay.
Let me, I will look, I'll do a little bit of digging because I don't have the link handy, but it's on our website. So I'll do a little bit of digging and I can send that to you.
Thank you so much. Thank
Absolutely.
You.
Hi, this is Linda with Legal Aid. I was just wondering if you apply for one of these grants, does that exclude you from applying for a community impact grant or one of the other grants during that year?
So that's a great question. It does not exclude you from applying for them. So we assume, you're going to have a lot of different projects. We want to take a fair look at all of those. I would say the only thing that we will do on that end is we will consider, if you get funded at $30,000 through equity and access, but that doesn't by any means exempt you from applying to the other programs. It just means that will come into the conversation that we'll have with the committee. So, we've definitely had organizations that we funded at a higher level through a different program, and then they come in through our capacity building grant for an emergency need, and we're like, that's fine. We're going to go ahead and fund that. Like this is an important thing for them. But the other funding that you've received for us does come into the conversation. So I would say when you think about the grant programs, by no means is it exclusionary. We don't eliminate people based on previous funding, but we do just consider it as part of the conversation. Okay. So you might want to think about like prioritizing. So if equity and access is the big push, apply for that first, and then just think about it that way.
And then just one other question, I know there's 2 grant cycles for the year. Do you have like a cap on the number of grants that you're funding or a certain level of funding that you give out during each cycle? Or
that's a great question. So we're still finalizing our budgets internally, but our budgets are very flexible internally because they ebb and flow over the course of the year. So, as donors want to get engaged with us or get engaged with our grant cycles, that budget can go up a lot or it can go down. So we're not trying to hit a specific number per se, but more so trying to see what's out there, make sure that we're responding to the needs of our community. Last year, it was actually really interesting. We did set, a tentative internal budget. It wasn't public facing, but something that we were trying to kind of, X amount of dollars we were trying to get out the door. And our first cycle, we had about 10 applications, and our second cycle, we had 45. So that number got blown out of the water. We really looked at it internally. We reassessed what needs we were seeing, what we were able to do. We found additional funding. We engaged our donors, and we were able to give out a lot more funding than we thought we would.
Thank you.
Yeah.
So these are all in the same deadline cycle, the capacity, the community, and equity. They're all in the same deadline.
So they're a little bit different. So our equity and access cycle, we are just running twice a year. So this time of year, that'll have a deadline of September 3rd. And then that second cycle, that'll take place in December, January.
Okay.
Capacity building and community impact are monthly grants. So we do a monthly cycle for those. They're a little bit smaller. They cap out at $10,000. And we look at those applications every month on or around the 15th of the month. And we do that so that those smaller grants can be really responsive. We know that needs pop up and they can pop up quickly, and you need to be able to respond to them quickly. So we want to make sure that we have, at least those smaller sources of funding available throughout the year, and that we can respond to them, within a month window.
Okay, thank you.
Mm-hmm. And Chris, thank you for sending that information through the chat. That was very helpful. So Anita, I don't know if you saw Chris sent a link to Ascend.
I pulled it up. I downloaded it already.
Oh, perfect.
Thank you.
Absolutely.
You're welcome.
What other questions does anyone have?
Angelica, this is Debbie from JSCS. How are you today?
Hi, I'm doing well. How are you? Thanks for joining us.
Good, thank you. I'm gonna, as I navigate the application, can I reach out to you with any, general questions as I go through it?
Absolutely. And I would say just for application questions, the easiest way to reach me is always email. Just because that gives me some time. Sometimes people have like very specific questions. It gives me time to, dig into any specific answers that I need to, especially with regarding applications.
Great, thank you.
Absolutely.
We're looking at, we want to, start the journey of building DEI into the, to the community and the internal population. So, we're looking at some external consultants to help us navigate that process to ensure, we are set up for success and the program is sustainable. over time to serve the community, you know, and the internal team. You know, traditionally, have you done funding through, you know, I know you said there's, you know, if we hire somebody to do some training, but have you seen consultants being brought into the mix to help an organization start this exciting journey?
So that's a great question. I think, you know, I haven't seen it come through equity and access as much in the consultant area. It doesn't mean it can't. It doesn't mean that, you know, there's not a first time. Like I said, last year was our first year. So we're really learning and growing with our community. I do think another good place to look at if you're looking for consultants or consultant support is the capacity building grant program. Like I said, that has a lower
Okay.
cap, so it's a little bit of a lower dollar amount, but that is specifically designed to support growing your organizational capacity. So if that's something, you know, that you need a consultant to come in and do the research or get the work started, that's a really great place to look for funding for that, because, you know, we want to be able to help expand what your nonprofit can do through the funding that we have tied to that program.
Great, thank you.
Jennifer, is your email available? Or, because the last thing I got was from Kim Adams.
Yes, so that's because I'm using Kim Adams' Zoom account.
Okay.
And that's because, you know, we have like a somewhat limited Zoom accounts internally.
Okay, all right.
I'll send my email through the chat right now.
Thank you very much.
Absolutely. Yes, and feel free to email me anytime. And yeah, this is just, you can notice I renamed myself from Kim Adams at the beginning of the Zoom call as well.
Yes, they're both nice names. Thank you.
I have one more question.
Yeah.
I was trying to give other people a chance, but since no one's talking, I'll jump in. So are these really meant to be a one-time, not necessarily capacity building like the separate grant is, or is this something that would be for a new project existing? Is there any preference to how that looks? Is it renewable, or is this really meant for a one-time opportunity?
I think that's a great question, and it's something we're exploring internally. So once again, last year was our first year. So what we saw last year was a very broad range of projects. You know, we saw some things that were new. We saw some things that were kind of based more in organizational support. So kind of those broader spectrum, but the organizations were strongly focused on this type of DEI work. And so it's something we're still navigating. I think that renewal is absolutely an option. We would have you go through the same application process and then kind of talk through, you know, what changes you were able to make, and then be able to grow from there. And that's something the committee would want to look at. You know, we started this program last year, a year in, here's where it's at. Here's what the changes that they've been able, the data that they've collected, the changes they've been able to see. Would we want to continue supporting? That's absolutely on the table. It's not off the table for this program at all. And then internally too, we are looking at what multi-year grants would look like. It's not something we've traditionally, you know, done a deep dive into. So it's something that we're exploring. It's not something that, you know, is public facing yet. It's not something we have a program for yet specifically, but it's something that we are looking at, because we know that, you know, organizations are able to make more of a difference if they know they have committed funding over time.
Thank you.
Are we able to, for instance, if we serve kinship caregivers as well as single heads of households, which could also be kinship caregivers, perhaps, but not all, are we able to serve more than one population, target population in this equity grant?
Absolutely. So that's another great thing to describe in that demographic area. We know, you know, it's hard to only have one target population, especially if you're starting a new program, or, you know, this is an area where you're collecting information. There's very few hard and fast guidelines, or very hard and fast, you know, parameters for this grant. We're basically looking at those financial barriers of between $5,000 and $30,000. Otherwise, we're very open. And like I said, it's interesting the way our process works, because we look at a rubric to kind of get an idea for who you're serving, you know, the impact that you're measuring, the types of things you'd be able to report back to us on. But then in the conversational side, that's really where the decisions happen, because we know that no two projects are going to look alike. We know that every project has its unique components, and we want to make sure that we leave space for that, that we honor that, and that we're taking all of that uniqueness into consideration too.
So possibly the overall arching intervention could be one thing, but the target populations could be multiple. Because
Absolutely.
we can't do 12 different activities.
Yes. No, and that can get very confusing too. So I think that's another really good thing to keep in mind is that, we as a committee, we each have our area of expertise. And I like to say, my area of expertise is grant making. Like I know that very well. I have committee members who will know healthcare, who will know education, who will know these different sectors very well. And together we can all combine our joint knowledge to make a good decision.
Okay.
But it can be a little bit confusing. Sometimes people do try to cram in, 3 or 4 different projects into one application. And that can be actually very confusing for the committee because the committee, is then trying to learn about your organization, learn about 3 or 4 different projects, learn about their different impacts. And honestly, our application is pretty short. We try to keep it short so that you aren't spending a lot of time, diving in too deeply in this. We want to make sure that we're respecting your time and your capacity as well. And so sometimes I think it's very helpful to give it as much of a focus as you can because it's helpful for our committee to be able to see that focus of that one project. Even if it's touching different populations, it's really helpful for us to see kind of what you're focusing on. And the more that you can do that through your application, just streamlining it, talking about the piece that you want us to look at, that's really helpful for us.
Okay, thank you.
Yeah. Chris, did you have any questions?
You know, put me on the hot seat.
Yeah.
I guess not specific to this, but maybe you could help give insight to this. So, for instance, one of the priorities listed are single mothers, right? How are organizations capturing that without towing that line from a person's privacy to also trying to help them out? Like, I'm at State College of Florida now, a lot of our population, they're in their 30s and 40s, and we're predominantly female. So naturally, there's going to be a lot of single mothers in that group, but we don't necessarily capture that accurately.
Yeah, I think that's a great question. So the reason that's there is one of our largest funds that we're working with, this Field of Interest Fund, is specifically for single mothers. So when we look at our pools of funding, we have funds that are tied to serving single mothers. So that's an important thing for us because we need something data-wise to be able to use that fund to support projects. Number one, I would say it's important to think that we know that especially as you're starting a new program or that populations change over time, we don't expect a concrete number. So it doesn't necessarily need to be 38 of the women that we're serving are single mothers. It can be roughly 30%. That's okay to just kind of give us a rough estimate. We know that, sometimes that's going to change. That's okay. We're 100% all right with that. Sometimes people are using the general demographics of their total population. So rather than saying, hey, within this 10-person program, if that's feels like a barrier to their privacy, they can use kind of a broader demographic. Okay, out of everybody we serve, 40% are single mothers. So we can apply that to this program as a general idea of how many single mothers to expect. Or sometimes there are those very specific programs where, they're serving 10 women and they know 6 of them are single mothers. They can provide that information too. Is that helpful?
It was.
Okay.
I mean, I had an idea. I was also thinking just broader, when you talk about other underrepresented populations, in particular, LGBTQ plus, because that's not an often captured thing on the paperworks, the different paperwork that we fill out but
absolutely. And that once again, that ties back to our funding sources. So that's where I list those things out mainly because we have funds that are tied to that. So if you have information that you can provide to us about that, or if you are one of the applications we looked at last year was specific to mental health needs of the LGBTQ plus population, we want to bring that to the forefront of your mind so that if you are doing something in that space, you're aware that, we have funds that are specifically tied to those populations. But if you're not, that's also okay. It's not going to rule you out of receiving funding. It's not going to eliminate you from consideration for the other funds we have available. It just means that you wouldn't qualify for those couple of funds. And that's where this year we built in an optional section in our application to like an optional question section that asks for information of those in the kind of some of those categories. The reason that that's there is that that can allow us to consider using some of those other funds that hit those specific target populations. You don't have to answer those questions. It says at the very beginning too, this isn't meant to exclude you from any type of funding. This is just hoping that we can consider other funds that we might have to support your project. Any other questions?
Now, this has been helpful. This
Very helpful.
session.
Thank you so much.
Of course.
Angela.
Thank you all for taking the time this morning. I think, I always like these conversations because I think it's a good time to ask questions and just hear, the mentality behind some of these things, like our optional question section, to make sure we're on the same page. And one thing I do want to bring up too is, I mentioned, I know that demographics change. We know that populations change over time. In our grant report, so should you apply, receive funding, our grant report section pulls information from your application. So it will say, you said in your application that you were going to serve this demographic. Has that changed? Why or why not? Or like, how has that changed? Those questions, I always want to make sure people hear this directly from us. They're not meant to be compliance based. I'm not going to read word for word and say, oh, this line of this demographic changed. We want to know why. We're curious. We want to know, was it unanticipated? Was it anticipated? Did you learn about a new need? What happened? So I just want to make sure too that if you are ever filling out one of those reports and you see that, it's not meant to say that if you say, yes, the demographics changed, that's going to dock points or be a worse report. We just want to know so that we can be looped in because we use these as a learning opportunity. We use your applications, we use your reports as an opportunity for us to learn about what's going on in our community, what's working in our community. And so for us, it's great to see those changes because we can see, maybe you started out here and then you had to pivot, and that's fabulous. You were able to pivot and make those changes. We just want to know about it. So same thing with your application. Don't be afraid to set goals. And, if you say in your impact area that, you want to see 30% of your population demonstrate a change, and then it comes back 20% did, that's okay. We're not going to hold you to that 30 as, a law or a rule. We're there to learn with you. And I just want to make sure that, we're not creating that type of fear as you're doing applications.
Thank you, Angelica.
Of course. Thank you, everyone. Thank you for being here today. I did get a question from Susan just about, we did record this. I'll share the link with you all after in case there's anything you want to revisit. But also, feel free to shoot me an email, give me a call, and we can always talk through specifics as they come up.
All right.
Thank you.
Thank you for that too, Jim report. Thank you. Okay.
Have a great weekend, everyone.
You too, Linda, everybody.
You
Bye-bye.
too.
Bye.
Bye.
Mhm.